Good morning to all the participants from the United States, and good afternoon and good evening to everybody else. Welcome to this webinar on recent advances in the treatment of autism, cerebral palsy, certain other neurological disorders. And we're going to focus today on a new field of medicine, that is regenerative medicine using cellular therapy and integrative medicine using oxygen-based therapies. I'm Dr. Alok Sharma. I'm a neurosurgeon, and I have a special interest in the field of regenerative medicine for various incurable neurological disorders. I'm director of both the Neurogen Brain and Spine Institute and KLS Wellness Institute, also professor and head of Department of Neurosurgery at the medical school in Mumbai. Why are we all here? We are all here because we all have children with special needs. We have children who are neurodiverse. Today, the entire thinking is shifting from looking at children with autism being less than. We are looking at them as being different, as being diverse. So it's very important for us to change our point of view, our thinking. Just like there are some people who are taller and shorter and fairer and darker and thinner and fatter, like that there are children whose brains function differently. So it's very important that we get this very clearly, that our children are not less than, they are different. This is really very, very important for us to understand. But these children do have certain limitations that don't let them live independent lives. And our job is to find solutions, simple solutions that can help them regain their independence. All we want for our children is not to be dependent. That's all we want. They should be able to live their lives independently without any special care. If you've accomplished that, we've accomplished everything. So that's the reason why we are here. And the focus of my talk is going to be on three broad areas of treatments. One is cellular therapy. The second is neurorehabilitation that you're all aware of, and certain integrative therapies. So the talk is going to be divided into three of these. Now, on the left-hand side here, you can see this is an X-ray of a leg that is fractured. You can see the bone is broken. And I ask you, let us say if any of us had a fracture of the leg, if our bone was broken, would we give rehabilitation on a broken bone? We would not, right? What would we do? We would go to an orthopedic doctor, he would put plates and screws, fix the fracture, and then we would give rehabilitation. But this is exactly what we are doing with our children with special needs. Here is a PET CT scan of a child with autism. The blue, all this blue that you see is hypometabolic, non-functional, inactive or damaged brain. And we are giving children rehabilitation on this brain. We are expecting our children to do things they cannot do because there's a part of their brain that's not functioning. It's just like expecting a child with a fracture to walk or run. They can't do it. But what if we could repair this damage and then give rehabilitation? And you can look at the scan here. The green is activity which has come back. And I'm here to share good news with you that this damage can be repaired. The problem is we are not even looking at this damage. This is a special scan called PET CT scan. And I'm sure none of you attending this webinar have had PET CT scans done on your children because, it's just not, considered as part of the investigation protocol. But if you do it, for the first time, you'll realize why your child has problems. Why is it that a child can't talk? Because the speech area is not functioning. Why does the child have hyperactive behavior? Why can't the child concentrate? Because there are parts of the brain that aren't working. It's only when you identify the problem that you can fix it. And I'm going to share with you how we can fix this problem. So there was an old thinking, a 200-year-old thinking, that once the nervous system is damaged, nothing can be done about it. There is no regeneration. But that has changed today. And the good news is that now we believe that it's possible, some amount of regeneration is possible by what's called cellular replacement and repair. We can repair the nervous system. That's the good news. That's what's changed in the last 20 or 25 years. So the way to replace cells is through a type of treatment that is called stem cells. And now we'll briefly look at what are stem cells. I'm sure all of you heard of stem cells. One of the reasons why all of you are attending this webinar is to know more about stem cells. So I'm going to, in a very simplified fashion, tell you what stem cells are and how they can help our children with autism and cerebral palsy. So cell therapy has shifted us from the state of hopelessness to one of hope. If earlier we were all in a dark tunnel and there was no light at the end of the tunnel, we don't know where to go. But for the first time today, medical science has the solution where there is light at the end of the tunnel. We know that it's possible to come out of the darkness that we have found ourselves in all these years. So the word stem comes from the stem of a tree. And just like the stem of a tree gives rise to branches, leaves, fruits, etc., there are some cells which can give rise to all cells of the body. And these cells are called stem cells. How do these stem cells work? First, they have the ability to multiply. So if you have a single stem cell, you can make thousands or millions of stem cells from it. So this ability to multiply is very special. Second, and most important, these stem cells convert into any type of tissue that we want. So the same stem cell can become a brain cell, or it can become a muscle cell or a heart cell. So this ability for cells to be able to convert into any other cell type is what gives stem cells the power and the potential to repair. Before this, I told you they multiply. Now I'm telling you they can convert. In other words, we have cells that will not only multiply and grow, but will convert to what we want. And when they convert, they start a process of replacement, repair, and regeneration. And so this is what has changed in the field of medicine. They also, now this picture is not from the internet, this is my own original research. It's very old, it's almost 15 years old, where these are, before, I did 10 years of basic research in the laboratory before we started treating patients. And during that period, you can see here, this is what a stem cell looks like. And we actually showed in the laboratory that these cells have the ability to convert into these brain cells. These are neurons. You can see they are brain cells. Not only do these stem cells convert, but they convert and they connect with each other. So, of course, we showed this before we started treating patients, that the stem cells we use have the potential to become brain and nerve cells and form connections. It's not just becoming nerve cells. They have to form connections. And on this picture, you can see that they are actually forming connections. Stem cells also have another ability. This is called Paracrine Effect medically. This is the ability to release growth factors. So there are several positive, healthy, healing growth factors, some like BDNF, brain-derived nerve growth factor, that have a reparative effect on the brain. And stem cells, when we put them inside, they generate these growth factors from the body, and that helps in the repair process. They also improve the blood supply. This is a process called angiogenesis, where earlier there was less blood supply. Once the stem cells go, they actually attract new blood towards them. Now, there are different types of stem cells, and we won't go into too much detail, but from your understanding, there are broadly two. There is autologous. That means when you take from your own body and put it back into your own body. In other words, we take from our child's body and put it back into our child's body. That is called autologous. Allogenic is when you take somebody else's cells and put it in your child. So in that there is a donor and your child is the recipient. In autologous, your child is the donor and your child is the recipient. So that's the broad difference. There are other different classifications. Broadly, you can divide stem cells into 4 types. There is embryonic stem cells. These are stem cells which are derived from spare embryos of test tube babies or from the fetus. And all of us, when we were conceived, uh, a mother's egg and father's sperm came together and formed what is called a fertilized egg. And this then started multiplying. And on the 5th day of life, we were a bundle of grape-like cells, all of us, on a 5th day of life in the mother's womb. And that was a bundle of embryonic stem cells, which means all of us started life as a bundle of embryonic stem cells. And from this, in the next 9 months, our whole body was formed. So what does it mean? It means that these cells have the potential to become any cell of the body. All right, so these are called embryonic stem cells. However, the use of embryonic stem cells clinically is controversial. There are some ethical issues. There are some religious issues. There are some medical issues as well, because these stem cells are known to be a little dangerous. They can produce tumors called teratomas. So we do not use embryonic stem cells. I wish to very clearly state, we do not use embryonic stem cells. The second type of stem cells is from the umbilical cord. This is the cord that connects the mother and baby at birth. Nowadays, you know that this is being preserved. Earlier, this was thrown away in the garbage after the delivery. But now these are being preserved. And if your baby's umbilical cord has been preserved, there are some places that are actually using this for various purposes. We, however, don't use this because the number of stem cells in the umbilical cord are lesser than what we need. And secondly, there is a preservative. When you take the stem cells and preserve it, you have to add a preservative. And the most important preservative for stem cells is something called DMSO, but this is toxic to the brain. That's why you can't inject it directly into the brain fluid. It has to be given IV. So we prefer not to use this. What we use is something called adult stem cells. They are called adult, but they occur in children as well. These are autologous stem cells in our bone. There are 2 areas where you can get them, in the bone and in the fat. We prefer the use of bone. And there are millions of stem cells there, and you can take them and put it back into your own child. And the last is called induced pluripotent stem cells. This is a combination of adult and embryonic. The outside is adult, the inside is embryonic. But this is a research stage only, it's not being used. So we use only adult stem. So everything I'm going to talk about now is adult stem cells. That means stem cells taken from the child's bone and put back into the child. Nothing from the outside, nothing controversial. So we work with adult stem cells because one, they're 100% safe. Adult stem cells have been used for the last 75 years for various blood disorders. They don't form tumors ever. They don't get rejected because they are your own cells. You can easily get them with a needle. No surgery is required to get them. Just a needle prick and you can extract them, and there are no ethical issues. That is where you get the stem cells over. How do you put them back? So you can put them back by injecting it through a needle into the lower spine fluid, because the spine fluid goes straight to the brain. So if you inject into the spine fluid in the lower back, the stem cells directly go to the brain. You can also inject them intravenously. You can inject them into the muscles. You can inject them into the arteries. You can put them through the nose. You can put them directly into the brain. But we prefer, for neurological disorders, we prefer this intrathecal method. So basically, what is stem cell therapy? We're using good cells to replace damaged cells. So this is the damage as shown on the PET scan of a child with autism. You give stem cells and the damage goes away. What's the scientific base for stem cell therapy? Well, the highest recognition in medicine is the Nobel Prize. You all have heard of the Nobel Prize. And 3 times between 1990 and 2012, the Nobel Prize was given to stem cell research. There is no field of medicine that has got the Nobel Prize 3 times in a 15-year period, but stem cells have. The stem cells that we use from the bone marrow, this got the Nobel Prize in 1990. So that's the scientific recognition of this field. What's the scientific base of the work that we do? So in the field of medicine, your work, it's important for your work to be published in scientific medical journals. because these are called peer-reviewed journals. So we have over 100 papers, 106 papers, um, various international and national journals, 16 on autism, 15 on cerebral palsy, 18 on muscular dystrophy, etc. So, what is the importance of this? See, when our data is published in a medical journal, it is called peer-reviewed. Peer-reviewed means somebody outside of us has studied our data, validated its scientific, medical, and ethical content, and then published it. So it's not just we are saying, somebody has cross-checked with it and let it be published in a journal. So it's very important that whenever you undergo a stem cell therapy, the one question you have to ask the center wherever you go is if their work has been published in medical journals, whether their results have been peer reviewed. This is very, very important. Apart from scientific journals, there are medical textbooks. These are textbooks that are studied by doctors and medical students. And in that now, they've started introducing chapters on stem cell therapy. So like there's this book on recent advances in autism. And they have introduced a chapter, Stem Cell Therapy in Autism. And they asked us to write it. So we are the authors of this chapter. You can see here. Likewise, in this book on cerebral palsy, published by Intech, this is a European publication, they introduced a chapter on stem cell therapy for cerebral palsy. Again, we were asked to write it. There's this book on physical disabilities, therapeutic indications. Again, the stem cell therapy in pediatric neurological disabilities was written by us. In this book on muscular dystrophy by Avid Science, the chapter on stem cell therapy in muscular dystrophy is written by us. So there are 2 points here. Medical textbooks are introducing chapters on stem cell therapy for autism, for cerebral palsy, for physical disabilities, for muscular dystrophy. And when international books are writing this and they're looking for who should write the chapter, they turn to us because we have the world's largest experience clinically and the largest number of scientific papers. So when something starts coming in medical books, now it is becoming more and more slowly a part of what everybody else considers to be regular medical treatments. Now in India, at the highest level, we have support for this work. Our Honorable Prime Minister, Shri Narendra Modi ji, when he went to Japan, he actually took time off from his schedule to visit the Stem Cell Institute of Professor Yamanaka. Professor Yamanaka won the Nobel Prize for stem cell work. It's not often that prime ministers take time out from everything else and visit a stem cell facility. In India as well, whenever he has an opportunity, he will visit stem cell labs. This is him in Bangalore with the Institute for Stem Cell Research. I'm very fortunate that in a book that I have written that is published in one of our regional languages, Honorable Prime Minister Shri Narendra Modi ji has written an introduction. So that's my book, and this is an introduction written by him. And that is me presenting that book to the Honorable Prime Minister, the book in which he has written an introduction. Again, it's not common. In fact, I don't know of any other doctor, any other in the country who has an introduction written by Shri Narendra Modi ji. So that speaks for itself. And our Honorable Prime Minister has been very passionate about his belief in the value of stem cell therapy, as we will see in this next speech that he made in Parliament, in the Indian Parliament, on stem cells.
मैं जापान गया, तो जापान मेरे कार्यक्रम में मैंने एक कार्यक्रम क्या जोड़ा, मैं वहां एक नोबेल लॉरिएट साइंटिस्ट याकामाहा को मिलने गया। मैं इसलिए किया गया कि उन्होंने स्टेम सेल के अंदर जो रिसर्च की है, मैंने जितना पढ़ा था तो मेरे मन में आया था शायद इनकी एक खोज हमारे काम आ सकती है। हम गए तो वहां गए, उनसे चर्चा की और बेंगलोर के हमारे साइंस इंस्टीट्यूट के साथ आज उस दिशा में हमारा काम हो रहा है कि स्टेम सेल्स के द्वारा हमारे युवा साइंटिस्ट कुछ खोज करें।
So that was our Prime Minister speaking in Parliament on stem cells. Now, let's come down to some more practical things. So how is this treatment done? if you want our, when we want our children to undergo this treatment, you should know exactly what is being done to them. So we'll share with you. The beauty of the treatment is that it is very, very simple. There is no surgery. There is no cutting. There is no stitching. There is nothing invasive. The whole treatment is done with 2 needle pricks. Yes, you heard me correctly. Just 2 needle pricks. So let's look at it. What we do first is we put a needle into the pelvic bone. The pelvic bone is just above the hip bone. And if you put your finger on the right side of your waist, you can actually feel it. It's just below the skin. So we put this needle into it. We give local anesthesia and we sedate the child. The child is sleeping. The child has no pain. And this takes about 20 minutes or so. Once we have taken out the bone marrow, the child is sent back to the room. And the bone marrow goes to the laboratory, where over the next 4 hours or so, the stem cells are separated from the bone marrow. And when the stem cells are separated, then with a very thin needle, we inject the stem cells into the spine fluid, and the spine fluid takes it to the brain. So with one needle, we aspirate, and with one needle, we inject 2 needle pricks. And what are we injecting to the child? Cells taken from the child. There is nothing from the outside. There is no artificial chemical, agent, drug. Our own good, healthy cells of the child from the bone are taken, filtered, stem cells separated, and put back in the child. So let's see a short video of how we do this. So that's the bone marrow aspiration. The child is sleeping. You can see we take it to a laboratory. We run it through various machines. The number, quality of cells is tested. And with a very thin needle, we then inject it back into the lumbar spine. We'll just watch this video again, because just for you to understand, once again, you can see that's the bone marrow aspiration. The child is sleeping. And I'm sorry, it's just the videos. Oh. Yeah, that's the video playing now. Just to repeat it, because it's important to understand what our child will undergo. 2 needle pricks. Okay, that's it. You can see this needle. This is thinner than the needle that is used to collect blood. And we just inject it with that. That's all there is to it. So all right, so that again, the needle aspiration, the stem cell separation, and then we inject it back. So now, very quickly, we will come to, we will look at a couple of conditions. We all know what autism is. It's a neurodevelopmental disorder. It was described, compared to other medical conditions, it was described quite late, 1943, normally diagnosed in the first 3 years of life. We now refer to it as a spectrum disorder. In fact, now we don't even, there is a question as to whether to consider it a disorder. We call these children as neurodiverse. And boys have it 4 times more than girls. Now, what is not recognized by governments and policymakers and the public at large is the huge increase in the incidence of autism over the last several years. In 2004, 1 out of 166 children had it. In 2020, it is 1 in 54. In 2022, CDC figures from the college, 1 in 44. Something is going wrong that the number of children with autism is increasing so rapidly and so phenomenally. This means that there are 70 million children, 70 million people on the spectrum. That's 1% of the world's population. That's not something small. 1% of the world's population today has autism. And this does not get the importance, the attention, the resources, the rights and the privileges that autism should get. And so it's important that as parents, we speak up, that this is something that needs attention. The symptoms can be broadly classified into 3 types. There's problem with communication, with social interaction, and there are certain repetitive behavioral issues. So what's new? I mean, why are we having this webinar. First, today, especially over the last 25, 30 years, we have a better understanding of autism through neuroimaging. We have technologies that can look into the brain and actually identify which parts of the brain are working less and which are working more, which are normal. So this has given a new insight. Secondly, we have the availability of stem cell therapy for autism, which can reverse the damage. So this is what is new. If you look at this picture, this is called a PET CT scan. And this blue area that you see, this is what is called hypometabolic. This is brain that's inactive. This is brain that's functioning less than normal. And this is brain that's possibly damaged. Now, because this brain is damaged, our children have the problem they have. All their symptoms come from this part not being okay. And we have studied this in more than 3,000 children, and we've put this together in a paper as well. There's a very well-recognized journal, the World Journal of Nuclear Medicine, where we are among the first to highlight what is happening in the brains of these children. We are through these scans, which parts of the brain are damaged. So what I'm saying, this work has been published in this journal. And what is new today, because when we have a better understanding, we also have treatments evolving. So what you have to understand and recognize is that autism, the treatment is always going to be multidisciplinary. As parents, we sometimes look for something. We want this one thing that will completely make our children normal. So whereas the good news is that we can help our children, the not good news is it won't happen. There's no one silver bullet. We have to use a combination of treatments. And the focus of this talk is what is that correct combination? So, of course, there are various forms of rehabilitation that we all know of. Behavioral therapy, speech therapy, occupational therapy, we all know of all of that. There are some other therapies like art-based therapy and aquatic therapy and all these things. There are complementary treatments, various biomedical treatments, chelation and stuff like that. And there are integrative therapies like hyperbaric oxygen and ozone. And there is, of course, stem cell therapy. So we'll have to use this combination, but we can get our children, to have their brains repaired with this combination and get them back to independent living. So let's briefly, I'm going to run through this a little fast because we all are aware of it, and I'll focus on the things that are new. So neurorehabilitation, this includes applied behavioral analysis. We all know what ABA is. There is behavior, there are things that happen before the behavior, and there are consequences, and by modulating these, you can modulate behavior. So this is just an example at our Institute of Behavioral Therapy. There is occupational therapy, we're all familiar with this. And there are different subsections of occupational therapy, from activities of daily living, play therapy, social skills, cognitive behavior, recreational, vocational, etc. This is our occupational therapy department at our place. Then there is sensory integration, which is a part of occupational therapy, but which basically focuses on the sensory issue. This is a SI room at our institute. There is speech therapy, which has a very important role since speech is a major concern. That's speech therapy at our institute. Earlier, it was believed that physiotherapy does not have a role to play in autism, and that's not correct, because we find many children do have physical issues like motor coordination, clumsiness, tone, gait, postural stability, etc. So we believe that physiotherapy also has a role in autism, and that's our physiotherapy department. Aquatic therapy is extremely useful in children on the spectrum. You can see the list of all the improvements that happen just from aquatic therapy, and that's aquatic therapy happening at our institute. Then there are various art-based therapies and music therapy and all those things. Then we have certain other treatments available like chelation, TRS, detox, etc. Then there's use of supplements, which I'm sure many of you used, vitamin B6, vitamin C, omega-3, DMT, prebiotics, etc. So all of us have used supplements at some point. Diet has a very important role to play, and there are certain foods that these children should be given, which are basically pro and prebiotics, a ketogenic, gluten-free, casein-free diet, and there are various other things, curcumin, camel milk, and all, which is shown to be beneficial. And there are some foods to definitely be avoided. Things with high sugar, additives, pesticides, things are genetically modified. We should avoid all these foods. The ketogenic diet is a high fat, adequate protein, and low carb diet. This also helps. But despite all this, are we doing enough? And the thing is, despite all the rehab, our children still don't get back speech. Our children still have behavioral issues. Our children still have, don't have attention and concentration. So how do we fix that? And this is the role of stem cell therapy. This is our data. Although we've treated about 3,000 patients, this is data analyzed from 700. And you can see that 33% of our kids have had a significant improvement, which means they are off the spectrum. Yes, you heard me correctly. They are no more on the autism spectrum. 29% of our kids have a moderate improvement. 25 have that means they are now independent, but they're still on the spectrum. 25% have a mild improvement. That means they're dependent, and about 10%, 10 to 11% do not improve. What we have found is there's an age correlation. That all the children in the significant group, they were all below 11 years. That means they were all actually before puberty. We find that puberty is an important cutoff point. If you treat the children before puberty, they do much better. In this, our analyzed data shows us that children below 5 have the best results of all. You treat your children before the age of 5 years, you can almost completely reverse their autism. The problem is, as age becomes more, the improvements reduce. So most of the children in the moderate were between 10 and 11. Between 10 and 20, and slowly the age, and all these kids who did not improve, they were over 20 years. So there is a definite age correlation between improvement after stem cells and the results. So early intervention is very, very useful. Now I'm here and I'm a responsible doctor, and I'm saying stem cell therapy can reverse. In 1/3 of the children, we can reverse them and get them off the spectrum. So on what base can I say? I must have data which is statistically significant, and I must have objective improvements. Not just what I say, but on scans, we must actually show the changes, and I'm going to show you some of that. So this is our data from our first paper. These are various scores. This is a CGI score. This is the Indian score for autism, and we have to take an average score of all the people before and an average after, and show that it is statistically significant, and we have shown that. Also, when you subdivide the different symptoms, social, emotional, speech, etc., you average out all of them before and take an average afterwards, and then we've shown all this is statistically significant. But this is the most important. Here you can see on top are slides where the blue is the damaged part, the inactive part, the part that was not working. This is the reason why our children have the symptoms they have of autism. You can see that above is the same brain. You are seeing the brain at different angles. And below is the same child 6 months after stem cell. And you can see that the damage is almost completely gone. So this, my dear friends, is objective proof. This is objective, solid evidence that the damage in children with autism, the brain damage in children with autism, can be reversed. This was not believed up to now. This was not known up to now, but this is a fact. We have proved it not 1, 200, 200, but in 3,000 children. Okay, so this is something that is new. This is something that you should be aware of, because this is the direct proof of the fact that there is an improvement. And here you can see again, before you can see all this damage, and you can see that afterwards it's gone. And again, before and afterwards. Then some people, we do the scan at 6 months, and then we have some people questioning us, but how do you know that this improvement continues? How do you know after 2 or 3 years it doesn't come back? So in a few children, we did it year after year. So you can see 2012, 13, 14, and we showed that you can see the blue here, you can see it's less in 13, and you can see it's still less in 14. So we've actually showed that the improvement is progressive. It continues once the improvement starts. It doesn't go backwards. It doesn't regress. In other words, once that blue becomes green, it never becomes blue again. The improvements continue. So now the world's first international paper on the role of stem cell therapy in autism has come from our country, from India, and that's actually from us. This is the world's first paper, and we have published this. Basically, It was an open label proof of concept study of autologous bone marrow cells in autism. The world's second paper came from China. The third paper came from Italy. It was joined from Italy and Ukraine. The fourth and fifth papers have come from the United States of America. And so now there is slowly, people all over the world are showing these two papers from America have come from the Duke University. They are pioneering this work as well. And but we have the world's first paper. And we have a total of 16 scientific papers. And I have some videos of children from all the 5 continents, a child from America, one from UK, one from Africa, Asia and Australia. But for want of time, we'll just show you maybe 2 or 3 of these. Let's look at this first film, which is this child from the United States. The father is a cardiologist, a practicing doctor in America. The mother is a nurse, so you have both medical parents. And let's see how stem cells at Neurogen could shift their life.
I couldn't get him to engage with me. I couldn't get him to give me eye contact. Over time, he started to lose a lot of vocabulary. Right around 18 months to the age of 2 years, he just slid backwards.
He would flap like that, and he would walk on his tiptoes, look at the wall and be talking to the wall. He had problems with eye contact. He'd never look you straight in the eye. He had problems with his speech. Some research and found out about Neurogen. And the big question that I had in my own mind was, what is there to lose? And I could not come up with a good answer. And I said, we have to do it.
We started seeing better eye contact, definitely a difference in his engagement with us, with his siblings, his mood. He was so much calmer. Now he's all about taking his own shower. I have to just prompt him to get out, but he'll wash himself and he'll put his clothes on. Saw the PET scan images. I can't tell you the word. We were just so excited and thrilled. The areas that were hypoactive or non-active were warm. There was activity there. Ganesh has gone from the 3rd grade, 4th month reading level to a 7th grade, 1st month reading level in 5 months.
So Ganesh is not only, he's off the spectrum, but he's getting A grades and topping in his class. So that is the magic of stem cells. Now, we all know how difficult and challenging it is to manage, your child who's on the autism spectrum. Managing one child is so difficult. I'm going to show you a story of a mother who had triplets. All 3 had autism, and how these triplets benefited from our treatment. So imagine having to look after 3 children.
We went to different doctors, we went to different hospitals.
They are from Nairobi.
And when I brought it up, they were like, oh, no, don't worry. It's because they are boys, they are triplets, they were premature. I'll be walking out and I'm like, bye. No child is crying, no child is waving back bye. And by then, for sure, I knew that they should be doing that. Children had this behavior of disappearing. In fact, Eric disappeared 3 times in the middle of the night. The biting, the spitting, the scratching. How are we going to stop this behavior? We went to see the neurologist, and in 5 minutes, he said, these children are autistic.
As parents, it was very traumatizing. First of all, we didn't understand what autistic means.
So I decided to really get to read a lot about autism. I remember the first time I read about stem cell. I was like, wow, this is really good.
We had a lot of questions which we asked, and we got very clear answers from Dr. Sharma.
The day of the stem cell itself came, actually, I was a bit anxious, of course, but really I didn't have fear. A bit of apprehension, anxiety, of course, as a mother, but I knew they're in good hands.
We put a needle in this pelvic bone and then we take out the bone marrow, which is the fluid inside the bone. The pure stem cells, once they are ready, a thin needle is inserted into the lower back. We inject the stem cells into the cerebrospinal fluid. It flows all the way up to the brain.
Things that would have taken probably years to be accomplished in my sons, in like 8 months' time, we've really been able to come very far.
They used to defecate on their clothes, but now they can use the toilet. We've seen a lot of improvement in terms of spitting. The tantrums have reduced. Sleeping used to be a problem before, but at the moment, he is taken to his bed, it takes a few minutes and he is asleep.
See my son's cycle. You try to make them understand what it is to pedal, and they couldn't. But after stem cell, when we arrived in Kenya the following day, when we went out, and these guys could cycle. I'm going to send you to buy tomato paste, okay? I'm going to send you to buy what? In the shop. Where is the shop?
It's here.
Okay. So I'm going to give you
Money.
for what?
Buy tomato lollipop. I'm going to wear my shoes. That's right.
Parents ask me, so do you really think stem cell works? And I'm like, I can see changes, I can touch, I can feel, I can smell. Of course, for me, stem cell works. I'll do it until my children get well.
So that was a family from Africa, Nairobi, and quickly one more from Asia, from India. This child who
Shantanu was my first child, so I was very excited about how he would be. But when I came to know that my child has a problem, it shocked me and I wondered, why did this happen only to me?
Shantanu's behavior was very different from that of other normal children. For example, normal children walk on their feet, but Shantanu walked on his toes.
It has been 2 months since Shantanu's stem cell therapy. There have been many changes and many improvements. His hyperactivity has reduced drastically, and his attention span has improved a lot. He sits patiently in one place. He has started coordinating with his sister very well. He plays with her very affectionately. We are glad we took the decision to give him stem cell therapy. It has been 6 months since the stem cell therapy. Shantanu has shown a lot of improvements. His hyperactivity is almost as good as non-existent. His handwriting has become much better. His eye contact has also become better. I have never seen Shantanu dancing, but now he takes a keen interest in dancing. He also likes to listen to music. He can now fold clothes. Earlier he was not able to fold even a handkerchief, but now he can easily fold blankets. He helps me in cutting vegetable and in cooking too. Goes to the market store for purchases. He passed his 10th grade. There have been improvements in many other aspects as well. For example, this emotional quotient has also increased. Now he hugs us very affectionately, calls me mother. Now he takes tuitions of other
This is
special
very
kids.
important. Today, this child, who was a special needs child, is taking tuitions for other special needs children. He's teaching deaf children. So that's the kind of improvement. Okay, we skip the other videos. We move on to cerebral palsy. Now, in cerebral palsy, there is brain damage, but the effects are seen more in the body, not so much in the mind. There are different types of cerebral palsy where one side is affected, only the legs are affected, all four limbs are affected. And as you can see on the scan, the damage is more extensive and more severe as well. We have certain medical and surgical treatments for this, but they only give temporary or partial relief. They don't, get rid of the brain damage. So what are the results of our stem cell therapy? And you can see here data that 20% of our kids have a significant improvement, 41 moderate, 30% mild. Again, 9% don't improve. Now, in cerebral palsy, there is no age correlation. In autism, there was an age correlation. Here we find the improvement is based on the severity. The more severe the child, the lesser the improvements. The less severe, more significant improvements. And here's a scan. You can see the scan on the left-hand side, the blue. This is the damage before the stem cells. And in the same child, after the stem cells, you can see the damage is almost completely gone. So even in cerebral palsy, even where the damage is more extensive, stem cells can and do repair the brain damage. Again, here you can see the damage before and you can see below the repair afterwards. Here too, we have a paper, a clinical study which we published. This clinical study was published to show the effects of bone marrow mononuclear cells in cerebral palsy. Of course, it's not the world's first paper. In autism, we published the first paper. In cerebral palsy, others have published before us. And we have several other papers as well. And let's see this video from a child from, again, Nairobi, Kenya, who was totally wheelchair bound, could not stand, use his legs. And you can see the improvements. He's able to sit himself, which earlier was not possible. He could move his shirt, he's able to pack. He was fine. He could not use his hands earlier at all. Earlier, he could not stand. Now you can see not only is he standing, he could open the fridge, take out a bottle of water as well. And there he is, from being a wheelchair-bound child. This child is now able to walk independently without support. That is the magic and power of stem cells. In intellectual disability, again, there is a lot of benefits here. Now you can see the damage in intellectual disability is lesser there as compared to cerebral palsy. And here you can see our results. 20% of our children had significant improvement, 25% moderate improvement, 39% mild, and 13% did not improve. Here again, there is an age correlation. So the older the child, the less the improvements. And these are the different functions that improve: cognition, memory, problem solving, social aspects, toilet training. And the world's first, now here again, we have the world's first paper. The world's first International PubMed Index paper on stem cell intellectual disability has been written by us. And here is objective. You can see before the stem cells, the blue is the damage, and after the stem cells, you can see the damage is gone. We have several other papers on this as well. Okay, so one question in your mind must be, how safe is this treatment? And that's a very valid and a very important question. So here's the good news. First, we've now treated almost 12,000 patients, and we've never had any major adverse event or complication. We've not had any child who's deteriorated neurologically. So that's the good news. No major or irreversible complications, but there are some minor complications. For example, we now have 3% of our children who already have a history of epilepsy. That means they already have convulsions, but they can have an increase in their epilepsy. 10% of our patients get a headache after the stem cell, which lasts for 2 days only. After 2 days, it settles. And some others will get nausea, vomiting, local pain, etc. So then now you have various integrative therapies. So we've looked at cell therapy, we've looked at rehabilitation, and now I'm going to introduce you to some additional treatments. These are called integrative therapies. So it's a combination of machines and equipment. All of these are not invasive. There is no procedure involved. The most important of these is hyperbaric oxygen therapy that you all know as HPOT. So what is the principle of, so these are hyperbaric chambers at our institute. And we basically in this, the child goes inside with one parent into the machine. It's transparent, it's comfortable, there's a TV screen, and oxygen is given at higher than 1 atmospheric pressure. So there you can see the parent and the child in the chamber. They're very comfortable, the children enjoy it. And what is the principle? So let me explain to you. It's like this. Normally, like you and I, we are breathing right now. We are breathing oxygen at 1 atmospheric pressure, all right? And at 1 atmospheric pressure in our blood, we have red blood cells, white blood cells, and there is a liquid called plasma. At 1 atmospheric pressure, only the red blood cells transmit the oxygen. On the other hand, when you go into the chamber, oxygen is given at 1.8 to 2 times the atmospheric pressure. The oxygen goes into the liquid. So the entire liquid of the blood, the plasma, carries oxygen. So look at this. This is what is happening to us now. And when you are in the chamber, the entire liquid of your blood is flush with oxygen. And so more oxygen reaches to different parts of the body, including the brain. So that's the benefit of hyperbaric oxygen. So it improves the body's immunity, stimulates oxygenation, improves metabolism, increases energy levels, and overall improves the functioning. So there are many benefits of stem cell therapy, of hyperbaric oxygen therapy, especially in autism. There's another therapy we use called ozone therapy. So what is ozone? Oxygen is O2 and ozone is O3. So it's a form of activated oxygen. And this basically has an anti-infective effect, killing viruses, bacteria, fungus, reduces inflammation, remove blood clots. Has got what is called an antioxidant effect. And this has various beneficial effects on the brain and the rest of the body as well. There are different ways it can be put. There's a chamber in which you sit and the ozone is given. You can breathe it through the nose. It can be given through the ear. It can be given to gut. We also use it to cleanse the gut. So ozone is given from the rectum, and that helps in cleansing the gut as well. So these are all the benefits from improving the immunity, increasing oxygenation, reducing inflammation, detoxification. And this is the explanation as to how ozone therapy helps in autism itself. We also do gut cleansing. We know that there is a relationship between the gut and the brain in all of us, especially children with autism. And we believe in cleansing the gut itself, and we have various machines and equipment. There are standard enemas, there are medications. And in some of the older children, we can also use something called colon hydrotherapy. This is a special machine we have that cleanses the gut. So we believe in combining gut cleansing in our integrative therapies. Then there is this, what is called deep tissue mobilization or acupressure. These are points that are given, and they help in various ways. This is a list of how acupressure helps in children with autism and cerebral palsy. We find this combination to be good. Then we also have identified that there are sometimes deficiency of vitamins. We find a lot of our children are low in vitamin D, in various B complex vitamins. And what we do is we test, evaluate, and whatever vitamins are deficient, we actually replace them. So apart from vitamins, we also find that there are some minerals, magnesium, calcium, zinc, selenium. So we replace what is missing. We don't just treat in general. We identify what's missing and we, sort of replace that. So these are the benefits of all the integrative therapies that we are now seeing. And so this is our institute, the Neurogen Brain and Spine Institute. This institute has been dedicated, specially set up for one reason only. It's not a general hospital where we treat everything. We only treat children and adults with neurological problems, okay, using a combination of stem cells, rehabilitation, and integrative therapies. So we've treated now more than 12,000 patients from 70 different countries, from all the 6 continents of the planet. This is our core team. We are the founders of Neurogen. Apart from myself, there is Dr. Nandini and Dr. Prerna. They are the stem cell experts. Dr. Jacob is country's leading neurorehabilitation therapist. And Dr. Himangi is a physician. She's actually a physician working in America at NYU in New York when she developed a disease called motor neuron disease. And in America, everybody said that, she would not survive for more than a few months because there's no treatment for it. But we treat motor neuron disease as well. So Dr. Himangi came to India. We treated her, and in America, she was given a few months to live. It's been over 12 years now, and she's not only has she recovered well, but she heads our research. So she's a living example of the magic and power of stem cells. That whereas in the United States, she was told that she won't live for that long. It's 12 years, and she's not only living, but is working for us as head of our research. So we believe in quality control. So we have a lot of accreditations like the ISO, good laboratory and good manufacturing practice. We are also certified by the European Medical Association for best medical practice. So this is an important accreditation from the European Medical Association, EMA. We have published several books, and we earlier used to write books for medical doctors, and then we found that more than doctors, parents are reading our books. So then we've now written several books, a parent guidebook for autism, cerebral palsy, muscular dystrophy, etc. We've written books for therapists, and all these books, all the books we write are available free of cost. You can go to our website, you can download these copies, even hard copies are delivered to anybody who wants them without any cost. We've received several recognitions. The most important of this is the Rose of Paracelsus Award that comes from the Socrates Nomination Committee of Oxford, UK. And this is given for pioneering research work. It's been a real honor to receive this award. We also got this award from the European Society for Quality Research. This is again for innovative research that is done, and we were given this award. We were given the award for the Best Stem Cell Therapy Center in India at the National Healthcare Awards in 2016. Again in 2018, this award was given to us by the Health Minister of India. Now, to help you make the decision, you could visit our website, which is neurogenbsi.com. You could email us at contact@neurogenbsi.com. We have a response time of less than 30 minutes, and you get a reply from a doctor, not from somebody clerical or administrative. A doctor will reply to any email you send to us within 30 minutes. You can send us a WhatsApp chat or a call, or you could phone us, or you could set up WhatsApp or Skype interviews. Once you've decided to take the stem cell therapy, a coordinator is appointed to you. So that coordinator will then be your single one-point contact. We try to make it as easy and as trouble-free for you to get here. So one point of contact to help you with your travel, whatever visas, and how to come here and the logistics. When you come here, you arrive on a Saturday. On Monday, we do all the evaluations. Tuesday is the day when the procedure is done. And Wednesday to Saturday is rehabilitation. Saturday, you can go home. But we now have a 1 week and a 2 week option. In the 2 week option, we add the integrative therapies. So my conclusion is that adult stem cell therapy is a safe and effective. If you notice, I've put safe before effective. Treatment may be effective, but it's unsafe. We don't want to subject our children to it. So 12,000 patients, and we have excellent safety. It's a safe and effective treatment for autism, CP, and for many other neurological disorders for which so far there were no other treatments available. Now we heard the Prime Minister of India talk about stem cells in Parliament, and the world's two biggest democracies are India and America. Now let's hear the former President of the United States has to say about stem cells.
Scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate the severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research. There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers, of seeking a day when words like terminal and incurable are potentially retired from our vocabulary.
So there it was, the President of the United States and the Prime Minister of India talking about the potential of stem cells. I think that speaks for itself. So does our clinical data, all our scientific publications. So I'm here with just one simple message. All of you have been told that there is no treatment possible for autism and cerebral palsy, that all you have to do is rehabilitation. And I'm here to tell you that based on our clinical experience of 12,000 patients, based on our scientific publications in peer-reviewed medical journals, over 100 of them, it is possible to treat the fundamental brain damage that is present in children with autism and cerebral palsy through a very simple and safe treatment method, which is stem cells, but that this needs to be combined with rehabilitation. Okay, so stem cells work together with rehabilitation. And what we are finding is that when we combine it with the other integrative oxygen-based therapies, we get the best results of all. So all our children have the potential in them, and I believe have the right to be able to lead functionally independent lives. We showed you a few videos, but there are thousands of children now who are off the spectrum. So I want to thank you for your attention, and we will be open to any questions. So Linda says the volume is not on, but now that's the end of the presentation. All right. Santhia says, will stem cells address gut issues and heavy metals? So as part of a treatment protocol, we do address the gut issues, not through the stem cells, but through per-rectal administration of ozone and other gut cleansing. So we have a gut cleansing program where we help our children who have gut issues. However, what we have seen is that when we do stem cells, almost all parents say that the gut issues which they had sort of have got resolved. So somehow, earlier we used to believe it was the gut problems that caused the brain damage. Now we believe the brain damage causes a slowing of gut movement, and that could be the cause. Once the brain improves, the gut improvement improves, and all these things get sorted out. So yes, stem cell therapies and our entire treatment will address the gut issues. About the heavy metals, no, our treatment doesn't address the heavy metals. That requires a separate treatment. But what our belief on this is that the heavy metals have done whatever damage they had to do, and we are repairing the damage done by the heavy metals. Santhya T again asks, if the kid has genetic issues, will their own stem cells help? So yes, Santhya, what happens is that we are not curing the genetic defect. What we are doing is repairing the brain damage. And we are taking healthy and good cells. Before we put the cells, all these cells get tested, and we only put good, normal, healthy cells back. So in more than 3,000 children with autism, it is corrected. Even in genetic disorders like muscular dystrophy, we have found tremendous improvements with our children. Then Nandini Mukherjee says, we heard that a child gets spinal headache after the procedure for some time. What is the impact of that, and how should we minimize that? So yes, it's true. As you saw in my presentation, not all, but 10% of our kids. So that means 1 out of every 10 children will have a spinal headache. Now, a spinal headache is not harmful. It is not dangerous. It doesn't affect the stem cells negatively. It is no risk to the child. A spinal headache is a peculiar headache which comes only when the child sits and goes away when the child is lying down. So the way to prevent it is, we have found that on the day of the stem cell procedure, the child should be lying horizontal for that evening and night only. It's a little difficult and challenging, but if they can do that, that minimizes. Then we asked to put a lumbosacral belt, which we give the children, that minimizes, and appropriate hydration. So if we of course give intravenous fluids, but if with good hydration, a lumbosacral belt, and lying horizontal, we've been able to minimize the incidence. Should it happen, it lasts for 2 days during your stay. It never happens once you go back. So you never have a spinal headache back at home. It happens during the stay in 10% of our kids. It's completely treatable. It just requires rest. There is no headache when the child is lying down. So it has no impact on the treatment per se. Nicole Moon says, would our therapy be able to help my child who has a small cerebellum? She's 5.5 years old. Yes, Nicole, will be definitely be able to help your child. We treated many children with, cerebellar atrophy, ataxia, many symptoms related to a small cerebellum, and they all do very well. So definitely will be able to help. And anonymous attendee says, can you speak about the effects of stem cell therapy, especially facial mimicking and side effects, grimacing and hyperactivity? So now, in terms, see, we have to understand that when the stem cells go and stimulate the brain, it results in what the parents experience as hyperactivity, what the parents look at facial grimacing. This is actually the brain recovering. The child is trying to talk, and so the face will grimace. The child is getting a better understanding, and so there is hyperactivity. This is a sign that the stem cells are working. Now, it's negative for the parents because they say the child was not doing this earlier. But first, these are temporary. They last for a couple of months and then they go away. This is a process. For example, when we were born, we didn't start talking the day we were born. First we heard, we understood what was happening. Then we started making, sounds. We started making, there were facial grimaces, and then slowly first words came. And then we had, combination of words and sentences. So there is a recovery. And during this recovery, we will have some hyperactivity. It's a couple of months and it does settle down. It's actually a sign that the brain is improving. Another anonymous says, in the US, the procedure is not available widely. Any reason for that, and will that change soon? So in the United States, the Duke University is now offering this treatment, and it's not freely available because America was a little slow to pick up on this technology. So stem cell therapy developed in Asian countries, in China, Japan, Korea, and India. We started doing this work almost 20 years ago. In America, the work has started far more recently, but it is slowly picking up. Some states have made a law. The state of Texas has made a special law for stem cells called Charlie's Law. You can actually Google it. It's a law for stem cells, which allows the stem cell that we are doing, autologous adult stem cells, are actually permitted in the state of Texas by law. It's called Charlie's Law. You should read about it. Unfortunately, because it's developed more here, it's going to take time for it to be more available. There have been some court cases. There are some people who, between the FDA and the service provider. So there are a lot of multiple issues why stem cells are not widely available in the US, but they are. But like I said, it developed more in the East. So now Vandana Chaudhary says, how effective have you found stem cell therapy for kids with multiple disabilities and seizures? Stem cell therapy, Vandana, is wonderful for children with multiple disabilities, but it does not work for seizures. Stem cell therapy is not a treatment for seizures. In fact, in 3% of the patients, the seizures increase. So we never say that stem cell therapy is a treatment for seizures. But for multiple disabilities, yes, it definitely works. Ashley Gotski says, when you complete stem cell therapy, does it require multiple injections or only one injection? So that's a good question, Ashley. See, when we do the PET scan, we divide the damage into three. It's either mild, moderate, or severe. If it's about less than 15% brain damage, we call it mild. If it's between 15 to 30%, we call it moderate. If it's 30 to 45%, we call it severe. Now, if the damage is mild, it responds to a single treatment. If the damage is moderate, it will need 2 treatments. If the damage is severe, it will need 3 treatments, fundamentally. So this we can tell you only after we do the PET scan. So, so it may take a single treatment or 2 or 3. Then an anonymous attendee says, what do you think of the GFCF diet? Should be started before TBS? Is it required after the treatment? So a GFCF diet is great. It's wonderful. A lot of children have responded well to it. However, it's not going to take that brain damage. You know the PET scan I showed you, all the blue area? No diet in the world is going to fix that. All the diets, whether it's GFCF or whether it's ketogenic, whatever diet, they help in overall improvement of the body's functioning. Like even if we had to shift to a ketogenic diet, we would improve in our health. So it affects the general health. It improves symptomatically. We advocate it, but it does not fix the damage. So it's useful as an addition to, as an adjuvant. Nagarjuna Reddy asks, my son is 15 years old. He has ASD. Can we take SCT and how much percentage improvement can we expect? So Nagarjuna, at 15 years, your child is, he's a little older. Ideally, the best results come after below 11. So he's older, but he will improve for sure. Only thing is we may have to treat him more than once. The percentage improvement will be based on once you do the PET CT scan. So once you do the PET scan, we'll have a clear idea as to how much damage there is and what percentage. I mean, without having seen your child clinically and without having seen his scan reports, it's be very difficult for me to say what percentage improvement that we can expect. But there will definitely be improvements. Madhu Reddy says, is this considered an inpatient or an outpatient treatment? No, this is an inpatient treatment. You have to be in a hospital for 7 days. How many sittings are required? Thought it depends on a case-by-case basis. I'm looking for average stats. So like I repeated again, the sittings, number of sittings depends on the extent of damage on the PET CT scan. I repeat it, if it's mild, that's less than 15%, you require a single treatment. If the brain damage is 15 to 30%, you require 2 treatments. If the damage is 30 to 45%, it requires 3 treatments. What does the cost differ for USA patients? Well, normally on a medium like this, as doctors, we normally don't discuss costing. For that, you're welcome to speak to our coordinator or our website, or come to our website and speak to our administrative staff. As a general rule and a principle, in the last 30 years of medical practice, I do not discuss costs on any public forum. Madhu Reddy says, does ST target other parts of the body cells to know the stem cells that we do are focused on the brain. So we do not work on other parts. In other cases, for example, in children with muscular dystrophy, there we inject stem cells into their muscles, into the hands and legs. But that's a different disease type. In autism and cerebral palsy, we inject only into the cerebrospinal fluid, so it does not affect other parts of the body. And anonymous attendee says, for a non-verbal child, does it make sense for him to have a speech therapist in a language he understands? Or is it possible in a foreign language? Now, of course, you need to have speech therapy in your language, but you have to understand that speech therapy, it's not just about making a child talk. There's a preparatory phase in which the child's, every aspect of the child's brain and his speech physiological areas have to be prepped up and got ready to talk. So speech therapy includes that as well. And then comes the actual talking. The actual talking will come spontaneously, but we have to get the brain repaired, and through therapy we have to get the speech areas activated. So speech therapy but finally, of course, a child who doesn't understand the language will have to be given speech therapy in their language. Linda Bazania says the volume came on just after I sent the text. Thank you, Dr. Sharma, for the present. Thank you so much, Linda. Syed Hassan says, as part of the therapy plan, do you also prescribe neurological medications such as Artane? Syed, each child is different. So when you come here, we look at the child overall, and if he requires medications, we will prescribe them. But this is different for each child. We have nothing, if medications are required, they are required. So yes, they are given in cases who require it. Anonymous attendee says, thank you for answering my questions. Would it need multiple stem cell treatments to be done to help the small cerebellum? And does it help to cure speech problems? So again, the multiple treatments will depend on the PET CT scan. It will definitely help cure the speech problems. So it will definitely help. Like I said, multiple or not will depend on the PET CT scan. Santhya, do you recommend chelation before or after stem cell therapy? Now, this depends, Santhya, on the metal levels. If the metal levels are extremely high, then we recommend you do the chelation before. If they are not very high, if they are moderately high, you don't require chelation at all because it doesn't come in the way of our treatment. Then we have another anonymous attendee says, will stem cell help 2-year-old with suspected mitochondrial disease and horizontal gaze paralysis? Yes, definitely. We've treated several hundred children and patients with mitochondrial disease, and the gaze paralysis is one part of it. That improves definitely. So of course we'll have to study the report, study the scan, but we have treated mitochondrial disease. Another anonymous attendee says, and lastly, would you recommend stem cells instead of HBOT to treat? No, we recommend a combination. So you're asking whether we should do stem cells or HBOT, and we are saying you should do both. At our institute, you get both. We give stem cells and we give HBOT. For a small cerebellum, HBOT as well as ozone therapy combined with stem cells works miraculously. Syed asks, I lost Syed there. Syed says, have you had much success with dyskinetic CP? Yes, we've had a lot of success. We've treated several dyskinetic CPs and they've done very well. I think I have answered most questions. All right, those were the question answers. Now I'm coming to the chat box. Sangeeta says, is asked if stem cells is a one-off process. I just answered that, or I'll repeat it. If the damage is mild, it is it's a one-off process. If the damage is moderate, it's a two-time process. If the damage is severe, it's 3 times. Will the stem cell therapy work on a child with CP who's non-verbal and non-physical? Absolutely, Sangeeta. Stem cell will work beautifully on children with CP who are non-verbal as well as non-physical. Nagarjuna says, my child is 15 years. Can we take the stem cell therapy? Yes, Nagarjuna, you can take, but you're saying he has ASD. So at 15 years, we are sort of a little late because the best results are below 11. But better late than never. So I would say that if you have to, let's do it now. Doing it after 20 years, the results are much less. At 15, you still get some results. Pinky Sharma says, hello, Dr. Sharma. Hello, Pinky. But you don't have a question, Pinky. If there's a question, feel free to ask me. Linda, thanks me for your time. We are grateful. Thank you, Linda. I appreciate that. Can you speak about the side effects, facial missing and hyperactivity? I think I answered that. Will HBOT flare use? No, we've actually not seen that ever. We have been using HBOT for all our patients. We've never seen a flare-up of yeast. Pinky says, how do I know 33% are off the spectrum? Can you explain what means off the spectrum? Off the spectrum means that, there is a clinical evaluation, Pinky, of, a clinical evaluation, psychologists, their scores, CAR scores, ISA scores, and all these scores. And when you do the scores, they're off the scores. The scores are normal. They are like neurotypical children. That is the meaning of off the spectrum. When objectively on the scores, you don't have autism, when your symptoms are gone, when the child's speech has come back, when the child is going to a normal school, when the child has independent activities of daily living, when the child does not have hyperactivity issues, the child has no meltdowns, that is called being off the spectrum. How do you track your patient's progress based on parents' review, next this aspect on being on top of patient progress by keeping in touch with parents? So we, except for the last 2 years, because we were shut down in 1920 because of the pandemic, and then we were for a long time, we had become a COVID hospital. We were not doing stem cells and neurological cases. We treated over 900 patients of COVID in our hospital. And except during the last 2 years, we do have a standard system of follow-up with patients. This is done on WhatsApp and email. Sometimes we are not able to reach everybody, but 95% or more of our patients are communicated with, and we are in fact in communication with patients who we have treated in 2008 and 9. Patients treated 13, 14 years ago. We still have a system of communication with them. Of course, our bulk of our major follow-up data is from patients who physically visit us. So those patients who are in Mumbai, in India, who are close by, when they physically come here, then we have an entire day of evaluation. It takes a whole day. It starts at 10 in the morning and it finishes at about 5 in the evening, where each department, the psychologist, the occupational therapist, the speech therapist, we do a detailed evaluation, and we repeat the PET scans. So, and there you see objective evidence. There was damage before and there is no damage. So when we say patients progress, it is based on 3 things: physical follow-ups, where we actually evaluate them, PET CT scans done over here, and in those patients who are not from here, with whom it is possible, we do physical telephonic follow-ups. And I do accept that that doesn't happen with all the patients all the time because of issues with time zones and non-receipt of calls and stuff like that. You ask, talk about your practice for analyze the local Indians as well. Why is there a price difference? The service is still the same. Fundamentally, like I said, I do not discuss pricing over here, but just want you to know that just as a general rule, I'm assuming that you live in America. If you live in America and if you go to a hospital in America for treatment, there is one set of pricing. Do you know if I want to take treatment from a hospital in America, the price is 3 to 4 times more. It's slightly different. Now, ours is not like that. It's what you have to understand is that each country has certain subsidies which are available to local taxpayers. So those people we have a standard rule. Those people who pay taxes in India get a subsidized cost. And those people who don't pay taxes in India get the standard cost. So there is a standard cost and a subsidized cost. So anybody who pays taxes in India is welcome to use the subsidized cost. But like I said, I'm talking about the general principles which are true of all hospitals, not just in India, but in the reverse as well. Even in the field of education, for example, a local student, when you study in America, you pay one set of fees. And if somebody from India goes, the fees is 3 to 4 times as much. So this is a fact of life. And the logic for this is that the subsidized cost, so you have to understand, it's not different. There's a standard cost and a subsidized cost. The subsidized cost is always available only to people who pay taxes in that country. All right, so that's the broad principle. The actual cost, well, feel free to talk to our people. They will guide you. What's the total cost? Sangeeta, well, you'll have to communicate with our people. Could you mention the cost? There are many middle class. All right. So we have a policy. We have a social work department. We have a very senior social worker who works with us. And anybody who cannot afford the cost can apply to our social worker. And then those people who cannot afford it, we subsidize them. So we have a corporate social responsibility. For example, any orphan child is treated free of cost. We even pay for their PET scans and everything else. So all orphans are treated free of cost. Then children who come from very poor rural areas, especially the tribals in India, they are treated without any cost or at a very, very basic cost. So nobody in neurogen refused treatment. But those who, as per our corporate social responsibility, come from areas where we know they cannot afford, they get free or subsidized costs. Then we have tie-ups with various trusts. So we have very, very highly reputed trusts and NGOs which support some of our patients. We have certain philanthropists, people who support treatment for some of the poor patients. So anybody who cannot afford it, you have to make an application. It gets reviewed by our social work department. Now here you have to give income proof and things like that. And this is what happens. We have people who will ask for financial help but will refuse to give income proof. So there is a protocol there. You want to be helped, there's a protocol, we make an application and we do consider it. Our policy is nobody should be deprived of the treatment for want of money. So, and then you also have to understand that patients who come from outside, there is the package is far more comprehensive. It includes everything from the airport, pickup, drop, all the investigation, everything is included. In the subsidized package, the accommodation is different. On the other hand, the patients who pay subsidized costs, their accommodation is different from those who pay the full cost. It doesn't include many of the costs for which they have to pay separately. So there's a whole lot of things. Our aim is, what is the fundamental? Those who do not have money and resources should still get the treatment without having to pay for it. But those who have the money and resources should be generous enough to spend money for something that is going to completely change the lives of their children. So that's what our broad philosophy as a corporate is. So if somebody cannot afford it, well, please write to us and we will help you. Can stem cell therapy cure exon 6 hypertonia? Yes, of course, definitely we can treat. We have treated several children with that. I didn't include this topic because I was told by the organizers of this that I had to speak only on autism and cerebral palsy. But yes, Tishe Sharma, we can definitely treat. Prakash, affordable for middle class families. Prakash, I just spoke about this. Anybody who cannot afford, please write to us. We have a social work department, but you have to answer all their questions and you'll have to supply all the concerned documents that they ask for. If they believe that you have to pay a subsidized cost, that subsidized cost will be applicable to you. Ashley asks how many injections are involved in stem cell therapy. Is it solely one extraction and injection, or does the process happen on multiple occurrences? No. Actually, it is a single extraction and a single injection at one setting. If we repeat it, it is repeated after 6 months. Since you brought up USC a lot today, how many Americans have you treated? Not Indian Americans, but typical Americans. People who tend to go more for Panama and other clinics. I don't have the details right now, but I do know that every week, because we have a weekly thing, there are at least 5, I think, more than 5 every week. So you're talking about 20 to 25 parents from America. And they're a mix. I would say more than half of these are not Indian Americans. We have, I would say, maybe more than half. So about 25 a month. So you can do the math. And about more than half of these are not Indian Americans. Well, people tend to go to Panama and other clinics in other countries because those, I understand, it's like a challenge to fly 15 to 20 hours to come to India. But what you have to understand now, since you brought up Panama, let me share with you the difference between Panama and us. First, we are the only stem cell therapy center in the world that treats only neurological patients. All right. Panama, Mexico, etc., they treat anything, liver, kidney, heart. You go there and they will treat anything from hair fall to cosmetic or whatever you want. So these are general stem cell therapy centers. We are a neurological institute. All right. There, they don't have any rehabilitation. We have an extensive rehab program. There, they do not do PET-CT scans. They do not do MRI. They do not do a detailed clinical evaluation. We have such a detailed evaluation. There is almost a 20-page document that is created of the clinical evaluation. They do not do integrative therapies. They do not do oxygen-based therapies. And most important, their work has not been published in international scientific peer-reviewed journals. All right. So big difference. We do only neurological patients. They do everything, which means the entire staff. I'm a neurosurgeon myself, but all the medical staff. I mean, Dr. Nandini, who's who's trained 4 years in neuro aspects of stem cells. Dr. Prerna, who is a neuropathologist trained in neuro aspect of stem cells. Dr. Jacob, who's a neuro rehabilitation specialist. So entire focus is neuro. I ask you one question. Okay, if you had a headache, would you go to, if you had a brain, let's say you had migraine, you had a brain tumor, you had something like this, would you go to a general doctor or would you go to a neuro specialist? Okay, would you go to an orthopedic doctor or some general doctor who treats everything? You go to a neuro doctor, right? So we are neuro. That's the difference between us, and people in America don't understand that. And we have a comprehensive treatment. We look at everyone. And most important, we have 107 scientific papers on our work. I don't think Panama has any. So, so in the medical world, unless your work is published and peer reviewed, there is no authenticity to your data. We don't know what they're talking about. And just to let you know that several patients, and I'm talking of over 100 or more, have gone to Panama, taken the treatment, and then come to us because they either haven't seen enough improvement or they've seen very less improvement. On the other hand, since we try and follow up almost most of our patients, we don't know of patients who've gone from us to Panama. So, of course, but I understand, flying 15, 20 hours to India is not the most comfortable thing. It's very difficult. It's very challenging. So going to Panama is not easy, but we are in a very advanced stage of, we've been working on it actually for the last couple of years, but it's going to come soon, of opening a neurogen facility in the Bahamas. We already have government permission. Yes, you heard me right. We already have government permission from the Bahamas government to start a neurogen facility there. But there's some logistics of putting it together that will be closer to you. It'll be easier to come, but of course, it'll be more expensive. All right, let's see. One of the other questions. I know that the child. So Pinky Sharma says, I know a parent personally told me that her child is very calm after SCT. And you told that parents is to the parent it's because of awareness. So please elaborate whether you talk of awareness is hyperactive or calm with the show sign of SCT working. See, what you have to understand is that each child is different. So on the PET scans of some children have hyperactivity already happening before, where things are going to. So it's all about balance. There is normal, there is hyperactivity, there is hypoactivity. Each child is different. So some kids who already are very hyperactive, things will settle. They'll become calmer. On the other hand, in some kids, there will be, it's not hyperactivity, it is just the child, as the child becomes more aware, they become more demanding, and because they can't communicate, you have to understand that hyperactivity is a way of a child trying to communicate, because the speech takes some time to come, and they communicate it through various behavioral ways. So each child is different. You can't compare it. Each child responds differently. Each child responds in different time frames. So both of these are important because they are different. Each child is different. Each child, there are children who are totally non-verbal. There are children who are verbal. There are children who are low functioning. There are children who are high functioning. There are children who have behavioral issues. There are children who don't have behavioral issues. So each child will respond differently. Is stem cell therapy safe to try on children with ultra-rare diseases? Yes, it's absolutely. I mean, it depends on what disease it is. What you have to know is that we have an institutional ethics committee that is registered with the Ministry of Health, Government of India, and our work is monitored by the institutional ethics committee. All the conditions we approve, we have to run through our institutional ethics committee. So, depending on what the rare disease is, if we believe that stem cells work, only then we can give it. So we don't treat all ultra-rare diseases. We will treat diseases where there is a neurological base, fundamental to the problem. How much improvement is expected in speech for autism? Again, it depends. Each child is different. We have some children who improve within 6 months. We have other children who take 2 to 3 years to get back speech. So each child is different. But, and of course, it depends on the age. So we have seen that children, when we treat them below 5, they tend to do much better. And then the next is children below 11. And the older the child gets, the lesser are the improvements. Also, we are now finding that this combination of integrative therapy, so we've introduced this just about 2 years ago. Post-pandemic, hyperbaric oxygen, ozone, etc. We started this in 2020 towards the end, and we are finding the combination helps in speech recovery better. Sangeeta says, my son in 7 has multiple disabilities with severe epilepsy. Let's see, adverse is epilepsy. Yes, Sangeeta, if the child has severe epilepsy, then there is a 3% possibility that the epilepsy could actually worsen. And what we do is we try to cover that with anticonvulsant medications, and we try to take care of that. So the answer to your question is that children with severe epilepsy, it is a problem, right? The epilepsy can get worse. So But each child is different. But should we decide to do it, we'd like to see the EEG of the child. We'll be doing an MRI of the brain to study how it is. We'll be looking at the PET scan, and we'll be looking at what medication the child has. We'll be looking at what is the frequency of the epilepsy, how often it is, how severe it is. Is it general? Is it absent? What it is? So there are multiple factors here, and based on that, we will take a decision. Pinky, you just mentioned that the personal resource cost, but I know there are plenty of parents with whom we have discussed the cost difference for foreigners. So I don't do that personally. The cost difference is discussed by, when the parents come here. Okay, that's a different thing. Once the parents are already in Neurogen and they discuss the cost with us, then I'm very happy to discuss the cost. I normally, you didn't hear what I said carefully. I said on a forum like this, like when taking lectures or when, on a webinar, as doctors, I'm not just talking about me, all doctors, we normally don't discuss cost when we are doing a public presentation. All right. Now, if somebody contacts us personally, that's a very different story. Okay. So there's a difference between something publicly and something personally. You have a personal conversation with me, that is different. And I very clearly said, in a public forum, we normally don't discuss cost. Yeah. And like I explained to you, the difference between foreigners versus local is exactly what happens in America as well. Exactly the same. In the medical, in the education field, just find out for yourself, what is the cost, like an undergrad student pays in any of your universities, local, state, and what is the cost an overseas patient pay? I'm telling you, it's 3 to 4 times as much. So that's the general principle everywhere. It's not foreigners versus locals. It is subsidized cost for locals versus standard costs for foreigners. Thank you, Doctor, for organizing this wonderful question. That's Sangeeta, I think. Thank you so much, Sangeeta. Hoping to see you in the near future. We look forward to seeing you as well, Sangeeta. Nicole says we came to the center 7 days ago. If you don't, at 7 days, you can't do stem cell, HBOT, and ozone. That requires a 15-day treatment. So we have a 7-day program, which is the stem cell and rehab, and we have a 15-day program, which includes HBOT, ozone, and everything else. How are follow-up scans done? Well, follow-up scans are done. You have to come to India after 6 months, so that is a mandatory second visit. So because the scan has to be done on the same machine on which we did the first scan. So it'd be difficult for you to do that scan in America. In America, the cash price is higher versus people who have insurance at the hospital and put the bill in charity. Pinky says a follow-up about your response. In America, the cash price is higher versus people who have insurance for them. So you agree that price is higher, right? Who have insurance, but then the hospital can put the bill in charity or give hefty discount as well. So I told you that we do give discounts. For example, I said an orphan child from anywhere in the world, a child whose both parents are not living, from anywhere in the world is treated free of cost. Free, okay? Because we believe that a child who has no parents, well, we become their, guardians. Like I said, for children from tribal areas, from rural areas, we do, free and subsidized. But we believe that, people who can afford to pay for the child's treatment should pay for the child's treatment. Those who cannot afford to pay, who don't have it, we do it without cost. Can a parent stay with the whole time in the hospital? Yes, Nicole, the parent has to stay. It's compulsory. You don't have a choice. You can't leave the child alone. You have to be with the parent. It's mandatory. We will not accept any child who comes alone. So one or both parents have to be with the child. It's a one-off process. I told you it's one-off only for my cases, moderate and severe. It has to be done twice or thrice. I think these questions have been repeated. My child is, we are going through the same question again. All right, looks like I have done everything. If I have missed anybody, raise your hand or do something. I think everything is done. Okay, looks like I am done. All the questions are done. I hope I could answer all your questions. In case I missed anybody, feel free to type a question now because I may have missed something. There are two. There is a chat and there is question answer. So, all right, looks like I'm done. So thank you everybody for being in this meeting, and I look forward to seeing most of you sometime in India and at Neurogen. Till then, take care. God bless.